10 Worst Foods for Prostate Health. The prostate is a little gland that plays a crucial role in men's reproductive health. It wraps around the urethra, the tube through which men urinate, and has a donut-like form when it is healthy. What's in your diet may have the power to reduce your risk for prostate cancer. There are some types of food that you should minimize or avoid to keep your prostate healthy. Before we start, welcome to Yummy Healthy Taste channel. Please like, comment, and subscribe. So, let's begin. Number 1. Alcohol. Long-term alcohol use may significantly increase the risk of developing advanced cancer. Alcohol stimulates the urge to urinate, which causes a more frequent and urgent need to urinate. Both the bladder and the prostate may get irritated by this dehydration effect. Men between the ages of 15 and 49 who drank at least 7 beers a week had a risk of high-grade prostate cancer that was more than twice as high as those who did not. Number 2. Fried food. Fried foods of any form like donuts, fried chicken, and fries are regarded as delicious and have earned the label comfort food in modern society. However, some studies found a 35% increased risk of prostate cancer in men who consumed more fried food. When oil is burned to high temperatures, potentially cancer-causing substances including polycyclic aromatic hydrocarbons and heterocyclic amines can develop. Number 3. Dairy. Consuming a lot of dairy products, such as cheese, whole milk, yogurt, and other dairy products, may increase your risk of developing prostate cancer. This comes from calcium and choline, two components in dairy products that may potentially affect how your prostate functions. Along with these two nutrients, the majority of dairy products also have saturated fats. Consuming more high-fat dairy products is also linked to an increased risk of benign prostate cancer. Number 4. Spicy foods. Spicy food is bad for the prostate if you have urinary issues. They are strong irritants, and any urinary symptoms you may be experiencing, especially urgency and urinary incontinence, could possibly get worse as a result. Spicy and acidic foods tend to irritate the bladder and prostate, which makes them worse for men with weakened prostate health. Number 5. Eggs. According to a large observational study, men who consumed 2.5 or more eggs per week had a higher risk of developing a deadly form of prostate cancer. Choline, which is found in eggs, and its metabolite betaine increase the risk of prostate cancer, which can be fatal. Choline consumption may increase the risk of prostate cancer by 70%. Number 6. Excess saturated fat. A higher risk of advanced prostate cancer has been associated with a high intake of animal fat or saturated fats, such as those in full-fat dairy and fatty meat products. Not only does it encourage inflammation, but it also generates the most aggressive inflammatory cytokines. It's well known that inflammation fuels the growth of cancer. Consuming in moderation is fine, but excessive consumption is not. Number 7. Excess salt. People who enjoy high-sodium foods are more likely to have symptoms of prostate disease. It may be beneficial for some men to consume a diet low in sodium. Extreme salt restriction is not advised, as sodium is a necessary nutrient for the body to manage its water levels. Ideally, we should minimize sodium and replace it with spices, which are safer and offer extra benefits such as anti-inflammatory and antioxidant substances that sodium lacks. Number 8. Red and processed meat. A high intake of both red and processed meats like beef, pork, lunch meats, sausage, and hot dogs, especially if it is well done, may be linked to an increased risk of prostate cancer. Heterocyclic amines, HCAs, could be to blame. HCAs are carcinogens created during high-heat cooking methods like broiling or grilling. Unlike meat, chicken doesn't seem to have the same effect, while fish, which is high in omega-3 fatty acids, has a protective effect. Number 9. Caffeine. Caffeine, like alcohol, have diuretic properties, which means they dehydrate you by increasing your desire to urinate. It can be difficult for people with enlarged prostates to empty their bladders, which causes discomfort. Furthermore, caffeine is a urinary tract irritant and causes additional symptoms that alcohol does not. As a result, patients suffering from lower urinary tract symptoms, LUTS, should ideally avoid caffeine-containing beverages and foods. Number 10. Salad dressings. Salad dressings are frequently unhealthy. The majority of them fall under the category of processed foods because they are heavily chemically packed. Additionally, they frequently include a lot of salt and saturated fats. Therefore, commercial salad dressings are not healthful. Instead, we could substitute them with olive oil and spices. They offer antioxidants and anti-inflammatory compounds that are good for our prostate and general wellness. So, in many cases, avoiding these foods could help stop prostate illness from developing in the first place. Avoiding them may improve the health of your prostate and lessen your symptoms if you have any type of prostate disease. However, it's a good idea to consult your doctor before making any dietary or supplement changes. Thanks for watching. Don't forget to subscribe, like, comment, and share. See you on the next video.